Good afternoon. Today I have a cluster of 3 new cases of COVID-19 to report in P.E.I. This brings our total number of cases to 76 since the pandemic began. The 3 cases are all females in their 20s. These cases are linked and are close contacts of one another. These positive test results were received today. None of these 3 individuals have a history of recent out-of-province travel, and they all work in restaurants in Charlottetown. They are all now at home, self-isolating and doing well, and mildly symptomatic. Contact tracing is underway. All close contacts will be identified and will be tested. Close contacts will be in self-isolation for 14 days and followed daily by public health. Although our investigation is just beginning, we wanted to quickly notify Islanders to be aware of public exposures related to this case. The A&W, 650 University Avenue. Anyone who is at this eating establishment on the following dates should monitor themselves closely for symptoms of COVID-19, and if symptoms develop, they should arrange to be tested and self-isolate until the results are received. The dates are as follows: Monday, November 30th, Wednesday, December 2nd, and Friday, December 4th. Anyone who was at Wendy's on 643 University Avenue in Charlottetown. Anyone who is at this restaurant on the following dates should monitor themselves closely for symptoms of COVID-19, and if symptoms develop, they should arrange to be tested and self-isolate until the results are received. Tuesday, December 1st, Wednesday, December 2nd, and Friday, December 4th. Anyone who traveled on T3 transit buses on the following dates and times should also monitor themselves closely for symptoms of COVID-19, and if symptoms develop, they should arrange to be tested and self-isolate until the results are received. The bus routes are as follows. Bus Route 1, Monday, November 30th, between 4 and 5 p.m. Bus Route 1, Wednesday, December 2nd, between 2 and 3 p.m. and between 10 and 11 p.m. Bus Route 1, Friday, December 4th, between 1:30 and 2:30. We anticipate that there may be additional public exposure notifications later today as we gather more information from these cases through our contact tracing process. Any additional public notifications will be posted on the provincial website and on government social media platforms. Today, the public health priorities are to identify and test all close contacts. The Park Street testing clinic will be open until 8 p.m. tonight to ensure that everyone who needs to be tested has access to this service. Thank you to Health P.E.I., including the testing clinic and laboratory staff, for their ongoing dedication and willingness to go above and beyond to respond to COVID-19. Please remember to bring your health card to the testing clinic. Over the next 24 to 48 hours, as our investigation continues, we will learn more about COVID-19 in our province. Public health staff will be working hard to identify potential sources of this infection. We will be following the key public health steps to contain the spread of COVID-19 in our community: early identification of close contacts, isolation, testing, and quarantine. The fact that these are new cases that are unrelated to travel is concerning. It is too early to suggest there is widespread community transmission. However, I am becoming increasingly concerned. Further decisions regarding additional public health measures in our province will be made in the next 2 or 3 days. We know that COVID-19 moves when we move and is easily transmitted in crowded and confined spaces where people have sustained contact. As I've stated before, I urge all Islanders to behave as there could be COVID next to them. I am again urging Islanders to keep their social circles small and practice the public health measures we have in place to keep us all safe. Wear a non-medical mask, physically distance, wash your hands regularly, stay home if feeling unwell, and most importantly, go get tested if experiencing any symptoms of COVID-19. As we continue to support one another and work together to limit the spread of COVID-19 in P.E.I., please be patient, Please be kind. Thank you.
Thank you, Dr. Morrison. Just before we go to questions from our friends in the media who happen to be working today, I would just like to echo some of the comments made by Dr. Morrison, in that in the last couple of weeks we have made some challenging decisions, including suspending the participation of our in the Atlantic bubble, and that's just 13 days ago. And even though we have those restrictions in place and they are designed to limit the potential import of the virus into the province, we should not let our guard down and think that that makes us totally immune to COVID-19. In the last week, we've seen some concerning situations, including the one case linked to one school in the province. And now today we have a new cluster of cases still under investigation, and that should serve and must serve as a demonstration that we are certainly not immune, and it remains crucial that we are ever mindful of the need to continue to practice extreme safety. In the next 24 to 48 hours, as Dr. Morrison has said, we will know more from the Chief Public Health Office about this recent cluster. But in the meantime, I'm asking Islanders for their help. I need you to remain vigilant. I need you to continue to wear masks. I need you to be mindful of social distancing. We need to limit our contacts, get tested if you have symptoms, and to continue to follow that important and critical and good advice from the Chief Public Health Office. I also know that, and I've heard this throughout the community and in the conversations that I've had, that there has been talk of vaccines, and that is a great flicker of hope as we look to the horizon. And I'm also acutely aware of the COVID fatigue that's running through each and every family, and I know that is tiresome. But that does not give us pause. That does not allow us to relax. And we cannot stop what we have been doing. Now is the time to double down. If we can see the finish line, now is the time to double down. We've done so well thus far. This is not the time to stop. This is not the time to change our focus. It's not the time to let our guard down. We are in the grip of a second wave across this country and in this region, and that requires each and every Prince Edward Islander to dig in just a little bit harder for just a little bit longer. I know this is tough. I know we need social interaction. I know the time of year we're in and how important that is. But at the same time, we need to be ever so careful, ever so mindful, and ever so cautious. And I would just end my comments by saying that Islanders have been leaders. And good leaders continue to lead by showing others the way forward. And this is the way forward for all of us. So be careful, dig in just a little bit longer. And from the bottom of my heart, we need you now just a little bit longer. We need you now more than ever. So with that, I will conclude my remarks and open up the floor to questions from those in the media.
Rose St. Pierre, Radio Canada.
Oui, ma question est pour Dr. Morrison. Si c'est possible de répéter en français, s'il vous plaît, l'annonce d'aujourd'hui.
Oui, bonjour. Alors aujourd'hui, ici à l'île Prince-Édouard, on annonce 3 nouveaux cas de COVID-19 et puis maintenant on a 76 cas en total pendant la pandémie. Les 3 cas sont en leur 20e an et puis ils sont les contacts qui sont proches de... Les 3 sont les close contacts. On vient de recevoir les résultats juste ce matin, cet après-midi, et puis on doit faire continuer de faire les contacts et investiguer ces cas. Ils travaillent à des restos ici à l'île Prince-Édouard, Wendy's, et puis on travaille au resto et puis on fait des annonces au public pour s'ils ont des symptômes, ils sont à A&W ou à Wendy's pendant certaines heures s'ils ont des symptômes, d'aller être testés.
Et puis, est-ce que c'est possible de préciser là, la source de l'infection que vous ne connaissez pas encore? Est-ce que ça vous inquiète?
Oui, ça m'inquiète, mais je sais qu'on est en train de faire plus de tests et de chercher plus d'informations et pour voir si on peut déterminer la source.
Merci.
Okay.
Travis Kingdon, CBC.
Hi, Dr. Morrison. I know you said it's early days still, but as you mentioned, with no travel outside of the Atlantic provinces and maybe P.E.I, I can't remember what you said, but what can you tell me about what you know about where this came from?
Hi, Travis. So at this point in time, as we mentioned, it's our priority is trying to learn as much as we can about any close contacts, identify any close contacts, do the testing of these close contacts over the next day. At this point in time, I do not know the source of this cluster of cases, and we will be doing everything we can to try to identify that source. But it certainly, as I mentioned, is of concern.
And you mentioned that in the next 24 to 48 hours, you'll be looking at kind of making adjustments to restrictions in the province if needed. Can you tell me a bit more about what those decisions will be based on?
Well, I think they'll be based on what we determine and what we find out from these cases and further testing and what those test results will show us. And we've talked at various points, if we start to see sort of that widespread community transmission, what measures do we have to put in place to try to minimize the impact to our community? So those conversations, of course, have been occurring all the way along, but we need a little more information at this point in time before we make those decisions.
And I just add, Travis, that when we watched what was going on in the last number of weeks across the maritime region in particular, we took the preemptive measures such as closing the border for that reason. But as I said in my notes and as Dr. Morrison has been saying continuously, that isn't the one magic potion. So every decision that we have made has been based on the epidemiology, on the cases and how things are going. And when we look ahead to having to possibly make such decisions that could be possible in the near future, it will be based on the information that we learned from this weekend and also as it continues throughout the region.
Thank you.
Mike Robar, The Guardian.
Good afternoon. I know, Dr. Morrison, you said that you can at this point say where it came from, but I wonder, given that this Wendy's location was one of the locations associated with the cases last weekend, how likely is it that they might be connected or that this might be connected to Charlottetown Rural?
At this point, there's no indication it is connected to Charlottetown Rural. Certainly, again, we just literally got off the phone with a couple of the cases before coming down here, but based on my initial speaking to the cases over the course of the day, I do not believe it is linked in that way.
Okay. And I wonder, and it may be too early at this stage to say, but I wonder if, given the two restaurant locations and the bus routes, if you know or how many people you expect to get tested from this.
I'm not sure how many people will get tested. I know that Health P.E.I, of course, is responding and extending the hours in anticipation there could be more. It's really the public exposures are likely to have been fairly brief. They wear masks, for instance, on the bus. The bus route is along that area is not particularly long. I know they do good cleaning of the terrific cleaning and defogging of the buses. So I think So I think the public exposures are minimal, and that's why we really are saying if you have any symptoms, go get tested, but appreciating that there'll be some who, even without symptoms, may end up wanting to get tested as well. But it'll be important that, especially with an exposure that may have just happened yesterday, that getting tested today may be too early, so it would be important to watch for those symptoms over the days ahead, actually for the next 14 days.
Thank you.
Laurent Rigaud, Le Voir.
Oui, bonjour, docteur Morrison. J'avais une question sur les restaurants que vous avez mentionnés. Est-ce qu'aujourd'hui, ces restaurants sont fermés ou ils peuvent continuer à servir des clients?
Bonne question, Laurent. Alors, les restos annoncés aujourd'hui avec les exposures on demande pour qu'ils ferment, pour que toutes les personnes qui travaillent là-bas peuvent être testées et ils doivent rester chez eux. Et puis, il faut aussi nettoyer. Alors, on a contacté déjà, on a parlé à le propriétaire pour A&W et juste quand j'étais en train de descendre ici, on était en train de parler au propriétaire pour le Wendy's aussi. Alors, j'imagine que bientôt, il va être fermé aussi.
Merci. Et j'avais juste une question sur le nombre de cas actifs maintenant dans la province. Si je ne me trompe pas, il y a un cas qui est malade depuis plus que 2 semaines. Est-ce qu'il est toujours malade ou est-ce que celui-là, il est guéri?
C'est demain, les cas actifs qu'on avait déjà, j'espère, si tout va bien, demain, ils vont être un qui est recouvert et puis dans quelques jours, mardi, un autre recouvert à ce moment.
Merci beaucoup.
Okay.
Shane Ross, CBC.
Hello. Just to clarify, did these cases work at Wendy's and A&W, or are they just potential exposure sites?
I mean, I think we didn't really, I guess, identify that clearly, but they are exposure sites, but these are our staff at the restaurants.
Okay, and is anything being done there? You know, what kind of health measures are being taken place at those restaurants now, if any?
Yes, and I'm sorry, Shane, because I did answer some of that in French. So we have contacted the owners of one restaurant, and then one was being contacted just as I was coming down here to speak to you. And both restaurants are being closed so that all staff can be tested and are being asked to go get tested, and they will isolate, of course, until their results come back negative. And that will also allow those restaurants to do enhanced cleaning in those locations. And those, so that is just underway, literally, I would anticipate as we speak.
Okay, so they're closed then. Right? Okay.
Yeah, or in the process of doing so, and
Okay.
Yes.
Thank you.
Okay.
Michael McDonald, Canadian Press. Michael McDonald, Canadian Press.
It's not there. I guess since Michael is not there, that's the end. So we will, within the next 48 hours, provide some more information as it arises. And thank Dr. Morrison and her staff for the quick turnaround here, and encourage all Islanders to keep your guard up. Thank you very much.